All right, welcome to the deep dive. Today, we're digging into something specific pets can face. Ear squamous cell carcinoma, SCC, right? In dogs and cats.
Yeah, that's it.
Yeah.
And we've got these sources, a clinical guide and overview, good stuff to really get into what this condition is all about.
So our mission here is to pull out the key info for you. What is ear SCC? Why might it happen? How do vets spot it?
And critically, how's it treated? And what are the chances? Ear issues are super common, we all know that.
Right.
But these sources really highlight that sometimes. Sometimes it's pointing to something much more serious under the surface.
Okay, so let's just jump right in. What exactly is the squamous cell carcinoma when it pops up in a pet's ear?
So basically, it's a type of cancer, a malignant one. It grows from the squamous epithelium. That's a specific type of cell lining parts of the ear.
And that lining is found in a few different ear locations.
Exactly. You've got the pinna, that's the outside flap, the part you scratch.
Sure.
Then the external ear canal, the tube going inwards. And sometimes, though it's less common, it can go deeper into the middle or even the inner ear structures.
Okay, and it seems like where it starts is a really big deal, like different between dogs and cats.
Huge difference. The sources are clear. SCC on the pinna, that ear flap, is way more common in cats, especially cats with like white or pale ears.
Got it. Cats, white ears, sun exposure on the flap.
Mm.
But pinna SCC in dogs is rare.
Yeah, pretty rare in dogs on the pinna itself. Now, when we talk about tumors inside the ear canal, that's different. We see those more often in older dogs and older cats.
So maybe not the most common ear problem overall, but when it does happen, we need to take it seriously because it can be quite aggressive. Okay, let's unpack the why. Why does this happen? Who's most likely to get it, and what are the potential triggers the sources point to?
Well, for those cat ear flaps, the pinna, the link to UV light, seems really strong. Sun exposure, basically.
Right.
Chronic sun damage over time, especially on those pale ear tips. So it's a major factor listed.
Makes sense, like skin cancer in people with fair skin, but on kitty ears.
Pretty much, yeah. Now, if we move inside the ear to the canal, chronic inflammation becomes a big suspect.
So like long-term ear infections, otitis.
Exactly. Those infections that just keep coming back or never fully clear up external or middle ear. The sources say that, yeah, in rare cases, that constant irritation might lead to malignant changes in the tissue down the line.
And I remember reading the sources hinted at breed shapes playing a role here. Maybe dogs with, smushed faces, narrow canals, or breeds with long, heavy, floppy ears.
Things that might trap moisture or make infections harder to clear. That chronic environment could theoretically raise the risk over many years. It's a connection the sources mention.
Are there other factors?
Yeah, a few others are floated. Genetics, maybe some cats are just predisposed. Possibly certain viruses like papilloma-type viruses, and even chemical exposure, things like hard chemicals. Maybe even certain older flea treatments were mentioned as potential irritants.
This is where it gets really interesting for owners, I think. What does it actually look like? What are the clues? Because the signs seem totally different depending on where this thing is growing.
Oh, dramatically different.
Yeah.
Let's start with the pinna, the ear flap.
Yeah.
In cats, especially light-colored ones, you might see reddish areas, crusty spots, maybe little ulcers or sores.
Right, on the tips, often.
Often on the tips, yeah. And they might not look like much at first, maybe flat, scaly. The sources even say they can seem to heal up and then come back, which can fool you.
So not always a big scary lump from the get-go.
No. And there's this pre-cancer stage called actinic dermatitis, basically sun damage causing crusty lesions. That's an early warning. If it gets advanced on the pinna, the ear tip can get deformed or even sort of disappear.
Wow.
And one more thing for cat pinnas. About 10–15% of cats with this can also get SCC spots elsewhere on their skin, totally unrelated to sun. It's called multicentric SCC in situ.
Good to know. But just to remind everyone, pinna SCC in dogs is uncommon. Much more likely something else going on there.
Correct. Okay, now moving deeper into the ear canal. Here, the signs often look like a really bad ear infection, but maybe one that just won't clear up or seems off.
Like what specifically?
Things like a really smelly discharge, could be waxy, pus-like, even bloody, lots of head shaking, scratching at the ear like crazy, swelling, obvious pain.
And didn't the sources mention something about an abscess below the ear?
Yes, a graining tract or abscess below the affected ear can definitely be a sign of trouble deeper in the canal. Also, sometimes difficulty opening the mouth or even some hearing loss.
Okay, what about the really deep ones? Middle or inner ear? Less common, but sounds scarier.
They are less common, but the signs can be more alarming because nerves often get involved. You might see things like a persistent head tilt, problems with balance fets, call it vestibular signs.
like they're dizzy.
Yeah, exactly.
Yeah.
Trouble blinking, maybe one side of the face seems droopy, that's facial nerve damage. Just general neurological weirdness, incoordination. Again, difficulty opening the jaw can happen with these deeper tumors too.
And lymph nodes, swollen glands.
Can happen, yeah. Especially the ones under the jaw or near the throat, the retropharyngeal or mandibular nodes. More likely with ear canal tumors, though. Pretty rare if it's just on the pinna.
Okay, so lots of potential signs depending on location, but seeing a sign is one thing, getting a firm diagnosis is another. How do vets actually figure out if it is SCC? Sounds like a
Oh,
process.
it's definitely a process. You can't just eyeball this. It starts, of course, with a really good physical exam, looking closely at the ear, inside and out.
And maybe taking a sample of the gunk, cytology.
They might do cytology, yeah. Look at cells from discharge or a swab under the microscope. But the sources warn it has limits. Lots of inflammation or a secondary infection can hide the cancer cells. It's often not definitive.
Which leads to the biopsy, I assume. The sources seem to really stress that.
Absolutely essential. You need an actual tissue sample, a biopsy sent off for histopathology. That's the gold standard to confirm it's SCC and not something else.
And getting that biopsy from deep in the canal sounds tricky.
It can be. That's where video otoscopy comes in handy. Using a small camera scope to see inside the canal helps guide the biopsy tool accurately.
Okay, biopsy confirms it. What about figuring out how bad it is, how far it spread? Imaging.
Imaging is crucial. The sources really push for CT scans. They say CT is much, much better than regular X-rays for seeing how far the tumor extends to soft tissues and, really importantly, if it's gotten into the bone.
Especially that bulla structure, that bony bit near the middle ear.
Exactly. Knowing if the bulla is involved is vital for planning surgery and predicting the outcome. CT shows that detail way better than X-rays.
So X-rays aren't totally useless, but maybe limited.
Limited, yeah. They might show some soft tissue swelling or bone changes, but not the fine detail. You also need chest X-rays. 3 views are recommended to check if it's spread to the lungs, though again, that's noted as rare, especially from just pinnae tumors.
Right. And then there's staging, like blood tests and checking lymph nodes.
Yep. Full staging workup. Blood tests, urinalysis, maybe an abdominal ultrasound just to check elsewhere, and definitely checking those regional lymph nodes often by sticking a needle in for an aspirate or even biopsying a node to see if cancer cells have traveled.
And under the microscope, the pathologist is looking for those specific signs, the squamous cells looking weird, maybe forming those little keratin pearls they mentioned.
That's the confirmation at the cellular level, yeah.
Okay, diagnosis confirmed, staging done. How do we treat this? It sounds like the plan really depends on what they found.
Very much tailored. It all hinges on where the tumor is, how big it is, and how invasive it's become.
And surgery seems like the main event.
Surgery is definitely the primary approach, the treatment of choice according to the sources. For tumors just on the pinna, often a partial or even total removal of the ear flap that's the pinnectomy is needed.
Making sure to get clean margins right, normal tissue all around it.
Critically important. Wide surgical margins are key to try and prevent it from coming back.
Now, for the deeper ones, ear canal, middle ear, the surgery sounds much more involved.
It is. For those, the standard recommendation is usually a total ear canal ablation TECA, combined with opening up that bony bulla, the lateral bulla osteotomy. So, TECABO. It's a major surgery aimed at removing the entire diseased canal and associated structures.
And just removing part of the canal isn't usually enough.
The sources specifically say that more limited surgeries, like just a lateral resection, are rarely curative for SCC in the canal. You generally need the full TECABO.
What about other treatments? Radiation.
Radiation therapy definitely has a role. It could be used after surgery, especially if they're worried about microscopic bits left behind, or sometimes as the main treatment if surgery just isn't an option for some reason.
I saw something called strontium plesiotherapy.
Yeah, that's mentioned as a type of superficial radiation, sometimes used for those pinnal tumors.
Okay. Chemotherapy. Is that common here?
Less common for ear SCC. The sources suggest it might be considered if the tumor is really aggressive or has spread. But they also note that, particularly for ear canal tumors, the actual benefit isn't super well established. Maybe some anecdotal benefit, but not proven consistently.
Gotcha. And things like freezing cryosurgery.
That's listed as an option, yeah, but usually only for very small, superficial lesions.
Right. And there were a few other things mentioned for pinna lesions, too. Photodynamic therapy, electrochemo.
Alternatives like photodynamic therapy, though they noted it can be less predictable, electrochemotherapy using bleomycin, or even curettage and diathermy, which is like scraping and cauterizing. More options for the surface stuff.
And what about medications? Weren't there some mention for early cat pinna issues?
Yes, important point. For those precancerous actinic dermatitis lesions on cat ear tips, some treatments have shown success. A topical cream called imiquimod, or oral meds like etretinate or acitretin. Even vitamin E was mentioned. But there's a really important warning with acitretin in pregnant women or those planning pregnancy absolutely should not handle that drug due to risks. That was highlighted.
Okay, treatment often involves major surgery. This brings us to the really tough question. What's the outlook? What's the prognosis?
Yeah, this is where it gets quite variable. It really depends on that location, the extent of the tumor, and if it is spread. Big differences.
So if it's caught early and just on the ear flap, the outlook is better.
Much better, generally. With complete surgical removal of a pinnal tumor, the prognosis is considered good. The sources mention survival times often exceeding a year and a half after a complete pinnectomy.
But as you go deeper, ear canal, middle ear, it's worse.
Significantly more guarded, yes. Ear canal tumors tend to be locally invasive. The sources quote figures like 57–67% invading nearby tissues. That makes recurrence after surgery a real concern, so the prognosis is guarded. And tumors starting in the middle or inner ear, those generally carry a poor prognosis.
And that bulla involvement we keep mentioning, that sounds like a critical turning point for prognosis.
It's a huge factor. The numbers in the sources really drive this home. For dogs with ear canal SEC, median survival with bull invasion was only about 5.3 months. Without bull invasion, over 58 months. That's massive.
Wow. What about cats?
For cats, the overall median survival for ear canal middle ear SEC was around 3.8 months. If they already have neurological signs, it drops to just 1.5 months. And again, bull involvement makes it worse.
So it hammers home that point, again, finding it early and treating it aggressively with complete surgery offers the best shot at longer-term control. Given the risk factors, especially suffering cats, can you do anything to prevent this? And what about follow-up care after treatment?
Well, prevention really centers on those high-risk cats, the pale-eared ones. The main advice is limiting direct sun exposure, especially during those peak hours, roughly 10 a.m. to 3 p.m.
Keep them indoors during the middle of the day, basically.
Pretty much, yeah. Or provide plenty of shade if they're outside. I saw one interesting note about maybe using yearly tattoos on those non-pigmented ear areas. An idea to add pigment.
Huh, interesting idea. Okay, and follow-up.
Absolutely essential. Regular checkups are key. That means physical exams, potentially repeat imaging like CT scans or X-rays depending on the original location and treatment, and keeping an eye on those lymph nodes. How often depends on the case, but close monitoring is needed.
Just one last quick check. Any risk to people? Can you catch this from your pet? Zoonotic potential.
No. The
Right.
sources are very clear on this. There's absolutely no evidence that ear SCC can spread from pets to humans. Zero risk there.
Wow. Okay, so that was a really deep dive into ear squamous cell carcinoma, pulling everything from those sources.
Yeah, we covered a lot. It's this malignant tumor, starts from specific ear cells. Big risk factors seem to be sun for cat ear tips, maybe chronic inflammation deeper inside.
And the signs look totally different depending on where it is, little crusts on the flap versus, head tilts or nasty discharge from the canal. Diagnosis needs multiple steps, exam, imaging like CT, and that crucial biopsy.
Right. Treatment is mostly surgery, often pretty major surgery like Tekabo for the deep ones. And the prognosis, well, it varies hugely. Much better for pinna only, much tougher if it's deep, especially with that bulla involvement.
It's definitely serious, but knowing these details, the causes, the subtle signs, why diagnosis has to be thorough, it really helps you as someone looking after a pet be more aware. It changes how you might look at a persistent ear problem, right?
Absolutely. It makes you think differently. And that leads to maybe a final thought for you listening. Considering how much detail we got on this one specific, fairly uncommon ear cancer, how does really focusing on those seemingly small or chronic changes in your pet's health maybe take on new importance now in terms of potentially catching something serious much earlier?